Good afternoon, ladies and gentlemen. Welcome to this new webinar from the International Health and Wealth Forum. First of all, from the International Health and Wealth Forum, we would like to wish you a happy new year 2017 and wishing you the best for this year that just came. Today, our speaker is Dr. Faiez Kirsten from South Africa with the topic merging medicine with health, wellness, and financial empowerment. Please, Dr. Kirsten, when you want, you can start with your presentation.
Okay, thank you very much, Alberto, for that introduction, and hello and welcome to everybody. Thank you for taking the time to join us today. I really do appreciate it. I'd also like to thank Alberto and Martin, of the IHW Forum for giving me this opportunity to speak to you today via this webinar. I really do appreciate it. Okay, so I'm here today to talk to you about two very serious crises, that the world faces. And more importantly, how to solve them. But not completely, because I don't think I have all the answers, but I think to a significant degree. And that is by merging medicine, with health, wellness, and financial empowerment, which of course is the title of this webinar. So really what I'm hoping to do is make a contribution to solving the global health and financial crises. Just a little bit about me. I'm a medical doctor, I'm a business graduate, I'm a researcher, author, health and wellness guide, and also hold a certificate in EFT, which stands for Emotional Freedom Techniques, which is a discipline of energy psychology. So the obvious question then is, why is there a need for health, wellness, and financial empowerment? And I think the obvious answer to that would be because most of humanity is disempowered, in these areas. So what we require is a new healthcare and new financial system or systems, because obviously the current ones don't actually work. So what we need is, if you can put it this way, new models of health, wellness, and financial care. Now, the health and financial disempowerment of humanity is seen in two global crises that I just mentioned. One of them is the global health crisis. Now, for quite a while now, the world's population has been getting sicker. You may or may not be aware of this. And in fact, people lose more years of healthy life, to illness today than they did in the 1990s. And this was a global burden of disease study that was done from 1990 to 2013. In fact, it found that 96% of the world's population is sick. And 1/3 of that 96%, that's 2.3 billion people, actually have more than 5 or more medical conditions. I mean, that is really shocking. So this is the study I'm referring to. It was published in the Lancet in June 2015, which is quite a prestigious medical journal. The other crisis I'm referring to, or I'm talking about today, is the global economic and financial crisis. And this is a really good book, that outlines and explains the crisis in some depth. It's called The Global Economic Crisis, The Great Depression of the 21st Century by Professor Michal Chossudovsky and Andrew Garvin Marshall, editors. Now, the global health crisis, has various causes and aspects. And the disease categories are they're categorized into 3 different categories: the conditions, the diseases or dysfunctions, category 1, 2, and 3. I'm not going to explain all 3 of them, but I highlighted in category 2, you have non-communicable diseases or chronic diseases. Now, these are something we have to take really seriously because they contribute the most to the global burden of disease and also to the global deaths. Number of people dying around the world die mainly from chronic diseases. So let's talk about the causes quickly of the global health crisis. Now, you may be familiar with the biopsychosocial model, which is commonly used in medicine to assess, diseases and dysfunction. And it really refers to the interplay of biological, psychological, social factors in the causation of disease and dysfunction. And the biological factors, include genetics and biology, psychological factors, thoughts, emotions, behaviors, and then social factors, your socio-environmental, societal, and cultural issues. But in my research, I uncovered that, in fact, most illnesses caused by chronic stress, which leads to inflammation. So I came up with this model, or this little explanation. Now, I know the slide looks very busy, but this is just the final outcome of a stepwise explanation how, chronic stress actually causes disease and dysfunction. And I'm not going to explain this model because it'll just take too much time. But even this model is not enough. We have to really understand there's more to the underlying causes of disease and dysfunction. And what I mean by this is the globalist agenda, which is ultimately really the drive of the global health crisis. Now, you may not be aware of it, or you may be aware of the globalist agenda. It's something we really have to understand if you really want to understand the global health crisis and the global financial crisis, economic crisis. And I'll just quickly explain what it is. It's a plan really to bring all of Earth's inhabitants under the control of a single state. Just one state, one world, controlled by one government. And the other name is the New World Order. And these people driving this agenda, they use various international institutions, like the IMF, the World Bank, and so forth to drive the agenda. And ultimately, they want to control everybody on the planet as a one world government. Now, this is not something, if you're not familiar with it, it may sound unbelievable. I can fully understand that. But I can assure you this is all facts, and there's enough evidence, to actually bear out what I'm saying. So there's a nice website, actually, if you really want to get a crystallized or summarized version of the globalist agenda, very nicely explained, clearly explained. It's on globalistagenda.org. If you go to that website, it explains, this agenda quite nicely. I can sort of also highlight a few quotes from those driving the agenda. This is one by David Rockefeller. This is one by Prince Philip, who wants to come back as a deadly virus, he says, after he dies, to deal with the population problem, the overpopulation problem, according to him. And then you have Ted Turner, who said something about decreasing the population of the world by 95%, and so forth. So Jacques Cousteau, James Warburg, they all had a lot to say. Have a lot to say. They mention a lot of things about the New World Order. This one I'll read out by Dr. Koch, who said the New World Order under the UN will reduce everything to one common denominator. The system will be made up of a single currency, single centrally financed government, single tax system, single language, single political system, single world court of justice, single state religion. Each person will have a registered number without which he will not be allowed to buy or sell. And there will be one universal world church. Anyone who refuses to take part in the universal system will have no right to exist. So this is really serious stuff that we're talking about here today, people. And so let's move on. How do they actually, this is very interesting, how do they actually get to drive this agenda and reach the stage that they've actually reached today? And this agenda has come quite far down the road, and they're not too far from achieving, what they want to achieve. And they really do it through controlling key aspects of society, the key systems, and really they control the power centers, the people who run those systems, and that's how they basically drive the agenda. So they control the monetary and financial system, the education system, the legal system, the media, healthcare system, political system, religion, philanthropic foundation, so forth. At succession, they determine who's going to replace those people running or at the head of the power centers of society. So a big tool that they use, and it's a really powerful thing, it's called mind programming. You're aware of mind control. Get people to believe what you want them to believe, and they perceive what you want them to perceive, and then they behave like you want them to behave. So perception management is a big part of mind control. And the other one is program ignorance, where they keep people distracted and, also just no time to do anything, especially in terms of seeking out the truth. And so they don't really know what's going on. Most people really don't know what's going on. And we mentioned that just now, what I mean by that. So I also came up with another model, because that model that I showed you on chronic stress, how it generates the global health crisis, wasn't enough. Or rather, chronic stress, how it causes disease and dysfunction. You really got to know how the global agenda generates the global health crisis. And this model, it's not complete, but it gives you a broad overview of how the whole thing works. I'm not going to explain this also, but I'm sure you get the gist of it. Again, on the globalistagenda.org site, you'll see this little diagram, which nicely explains how the control mechanism operates. Okay, let's get back to the global health crisis. Now, the global health crisis has many aspects, to it. There's an awareness crisis, like I just mentioned. People are just not aware of what's going on. There's information crisis. People are kept, information and knowledge information is kept away from them, so they're really not, they don't have it's program ignorance, like I mentioned. Then there's a critical thinking, crisis, where people are reluctant to apply critical thinking to what is going on in the world. But not only the recipients of healthcare services, but also those responsible for designing and implementing healthcare policies and strategies. I think they don't really critically think about, what is going on, why their countries are basically in such dire straits when it comes to the healthcare situation in their countries. So critical thinking is a huge problem, and I include this as part of the global health crisis. And then there's the cost crisis, the chronic diseases crisis, like I mentioned, access to healthcare service provider crisis, and then there's a healthcare service provider remuneration crisis, or a third-party payer situation. Let's just talk about the lack of awareness crisis. Awareness of self and environment is a meta skill. It's a broad, overarching skill, and quality and effectiveness of life flows directly from awareness. Now, enhanced awareness increases the self-regulation ability of the brain, and this enables better cognitive functioning, better lifestyle and behavioral choices, and it enhances emotional fitness, and also results, in overall improvement of health and wellness. Now, if you look at the cost crisis, in 2011, a World Economic Forum study projected that it will cost the people of the world $47 trillion over the next 20 years. So the people of the world are going to be paying $47 trillion for their health care starting in 2011, and we're in that time period right now. And most of that money is going to be spent on the 5 leading chronic diseases. Now, if you look at the statement that's come out from the World Health Organization, it says that 100 million people are pushed into poverty each year by their medical bills. That's really tragic. And the Director General of the World Health Organization, she had this to say. But it's not only, that people go into bankruptcy and poverty because they can't afford their health care, or their bills are so high that it pushes them into poverty and bankruptcy, but people also die because they can't afford, health care. So this is a really tragic situation that we're dealing with. And I mean, it's really millions, hundreds of thousands and millions that die every year. So let's look at the chronic disease part of the crisis. Now, this burden of chronic disease is rapidly increasing worldwide. And according, to the World Health Organization, again, in 2001, chronic diseases contributed, 43% to the global burden of disease, and it's projected that by 2020, that's in 3 years' time, it's going to contribute 60%. And then in 2001, it contributed 60% to global deaths, and in 2020, it's going to contribute 73%. And most deaths from chronic disease are due to cardiovascular disease, heart attacks and strokes and so forth. We move on to the access to healthcare service or healthcare provider services crisis. A report again by the World Health Organization showed that 400 million people, don't have access to essential health services, and I actually think this number is probably much higher. But I mean, 400 million alone is quite shocking. You can read this report at this URL, at this website. Okay, then there's another crisis, another part of the crisis, healthcare service provider remuneration crisis, or the third-party payer situation. There's lots that's written about this. Here's just 2 articles. One says third-party payers and perverse incentives, why we are on an unsustainable path. This one says how third-party payers crush entrepreneurs. It's a really diabolical situation when you have a third-party payer. There's a lot of myths also that generate and perpetuate the global health crisis, and I just really don't have time to talk about them today because there's just so much to cover. But there's a lot of false beliefs that are widely held by people in authority, people charged with the healthcare, services in their country, even the patients, the recipients of healthcare services. They all hold these myths, which perpetuates the crisis. Anyway, let's move on to the next crisis that I want to talk about, and that's the global financial and economic crisis. Now, I mentioned this book earlier on. It's really good. It covers the crisis, the economic crisis in much depth. And this is what Professor Chossudovsky says about the crisis in an overview. He says, we are at the crossroads of the most serious economic crisis in world history. The economic crisis has by no means reached its climax, as some economists have predicted. The crisis is deepening with the risk of seriously disrupting the structures of international trade and investment. And he says the economics profession, particularly universities, address the actual, okay, I can't really see much there, but he's very critical of mainstream economics and how it's actually taught in universities. And he says in economic science is an ideological construct which serves, to camouflage and justify the New World Order, which I just mentioned earlier on, the globalist agenda. I've studied economics, and I can really bear out what he's saying. This is what Professor Richard Werner says. He's a German professor. I think he's based in the UK. And he says that this very unlikely theory of equilibrium economics is what has been sold to us as a major insight of economics. It is pure propaganda. It has nothing to do with reality. There is no equilibrium. It is only in the theoretical dream world, a different planet, that markets are in equilibrium. And these are the words that he mentioned at a talk that he gave to the central bank in Moscow a while ago. And he says a lot of economics that is being taught, frankly, is not time well spent. And I think he's referring to the students studying the economics, those teaching it. I suppose some of those people teaching it really do know that what they're teaching is not largely true in many instances. And I sort of got to know about this when I studied economics myself. A lot of things didn't make sense to me at the time, and it was way back, in the late 1990s. Okay. So he says a solution to the economic crisis. I just want to minimize this. Okay, a solution to the economic crisis, he says, requires tackling the issue of debt by fundamentally modifying the relationship between creditors and debtors, controlling interest rates, erasing certain categories of debt, and ultimately challenging the overriding power of the creditors to dictate macroeconomic policy. Then he says the worldwide scramble to appropriate wealth through financial manipulation is the driving force behind this crisis. Now, this I must read out. He says the complexity of this crisis is overwhelming. While specific ad hoc measures, including the freeze of speculative trade, can be envisaged, there is no ready solutions under the prevailing global financial architecture. What is at stake is the power configuration behind these measures. Economic policy quite deliberately serves the interests of the financial elites, who in turn control the political process. Meaningful policies cannot be achieved without radically reforming the workings of the international banking system. And I've been saying this for a while, that the root cause of the global financial economic crisis are the minds of the people behind the banking system. So people across the land, nationally and internationally, must mobilize. This struggle to democratize the financial and fiscal apparatus must be broad-based and democratic, encompassing all sectors of society at all levels in all countries. What is ultimately required is to disarm the financial establishment. Now, I would like to pose a question to the audience, and that is, is this achievable? What do they think? Is this achievable? What Professor Chossudovsky has to say here. Now, if you understand the system, if you look at it, you'll think that the system is actually flawed. But I put it in sort of inverted commas here because it's not actually flawed. The system is not broken. It's actually built this way. It's actually built to disempower humanity. It's built to fail, and it's built to disempower humanity. So this sign here is really true. It's not, the system's not broken. It's designed this way. And so we have, I think Buckminster Fuller said it really well when he said, you never change things by fighting the existing reality. To change something, build a new model that makes the existing model obsolete. Really, really wise words. So let's move on to the solution then. And as I said, the solution is to merge medicine with health, wellness, and financial empowerment. So what does this entail? First of all, increasing awareness is vital. It's crucial, actually. On a global scale, we have to increase awareness. We have to abandon the allopathic model, because at least outside the trauma and emergency setting. We have to switch to the root cause medicine model. We've got to abandon the fee-for-service model. We've got to switch to a membership-based model. We've got to include health, wellness, and financial empowerment programs in the membership offering, and I'll explain what that means. You've got to exit the current banking and fiat currency system. You've got to switch to a gold-backed virtual currency on a trading platform linked to membership. And if people don't like, a virtual currency on a trading platform, and I'll explain what that means shortly, then there's always Bitcoin, and I'll say something about Bitcoin shortly also. So let's get to increasing awareness. Now, awareness is the foundation, to creating and exercising choice. In fact, awareness is key to freedom, to all sorts of freedom, to health freedom, to financial freedom, to freedom in general. If you're not aware, then you're really not going to achieve freedom. So the amount of awareness a person possesses really determines the degree to which they can choose what is good or bad for them. They can observe more clearly what is going on within themselves and in the environment. Awareness is related to brainwave patterns which prevail across the brain. People who have incoherent brainwave patterns, if there's no synchronization between the left and right hemispheres of the brain, then they have lots of problems with thought processes and so forth. Whereas On the other side, you have coherent brainwave patterns, and you have whole brain thinking, and that is associated with enhancing awareness. So brainwave patterns are closely correlated with thoughts and the ability to think clearly, emotions and ability to feel good, healthy functioning of the various systems of the body, stress levels, and so forth. In fact, brainwave patterns are closely correlated with the quality of life. I spoke about empowerment, and by this I mean participation in programs which educate and empower, from a health and wellness and financial perspective. And this is very crucial, actually. And programs must incorporate tools, to enhance awareness. And I'm talking about, tools to enhance visualization and brainwave entrainment and energy psychology tools. And all of these things actually rewire the brain, reprogram the subconscious, enhance awareness, all saying more or less the same thing. I thought I'd quickly, explain what optimal health and wellness really is. It's really a positive state of abundant energy, vitality, and well-being. It's characterized by vigor, physical and emotional fitness, mental clarity, and a profound awareness of what is good for the mind and body. It's an integration of mind, body, and spirit. It's really an understanding and awareness and appreciation that your thoughts, your beliefs, your feelings, and your behavior have a definite impact, on your state of health and that of the world also. In fact, it's a way of life. It's a lifestyle that you choose with the intention of achieving and maintaining the highest level of health and well-being that you're capable of. And to define health and wellness empowerment, it's really the process of empowering people with the knowledge, the tools, and the skills, to prevent and reverse disease and dysfunction and to optimize their health and wellness. So that's what I mean by empowerment, health and wellness empowerment. So I said we have to abandon the allopathic model because it's not intelligent. It just doesn't work. It's just wrong. So we have to abandon that, as at least outside of the trauma and emergency setting. We're not ready to abandon it from the trauma and emergency setting perspective because not enough research, I think, has been done to know how to treat emergency situations more naturally. We also got to switch to the root cause medicine model. I'm not going to talk too much about allopathic medicine, what it is, but just to give you an idea of what it is, to let you know, allopathy refers to the Western conventional mainstream medical model, which most of us are aware of, and it's based on managing disease and dysfunction. In other words, suppressing symptoms and pathophysiological processes with pharmaceutical drugs and so forth, physical intervention, surgery, and so forth. And the term was coined by German homeopathic physician Samuel Hahnemann. It was also known as the father of homeopathy. It's really dysfunctional medicine, and it's really deceptive medicine also because it creates the perception, that health is being taken care of, while fostering dependence on the healthcare system, on the pharmaceutical drugs, service providers, and so forth. Root cause medicine makes a lot of sense to me, though, I must say. It's also known as functional medicine. It seeks to determine the underlying causes of disease and dysfunction. It addresses the whole individual, not just these are symptoms and signs, and it includes physiological systems appraisal. You got to assess all the physiological systems. It requires, therapeutic partnership between physicians and their patients, and also you have to collect a lot of data in order to fully address, the patient's needs and to assist them on their journey to realizing, optimal health and wellness, or just, decent level of health and wellness. So we also have to abandon the fee-for-service remuneration model, like I said, and switch to the membership-based model. In fact, the fee-for-service and third-party remuneration models drives up costs. In fact, a Department of Health put out a report in 2002 which said that private healthcare sector was characterized by chronic cost increases significantly in excess of inflation and economic growth, which is a really serious situation. And the report blamed us on the fee-for-service reimbursement system and the third-party payment system. And it said that the fee-for-service system encouraged providers to oversupply services, while the third-party payer system shielded both providers and patients from full awareness of and responsibility for the cost of healthcare services. There the term awareness comes in again. And also the third-party payer system sours relationships because, the third-party payer doesn't have a contractual agreement with the healthcare service provider, and the transaction takes place between the healthcare service provider or the doctor and the patient. But the doctor gets paid by a non-transacting party. And oftentimes there's no legally binding agreement or guarantee of payment by the third party to pay the doctor. Although today I know there's designated service providers and there's healthcare service provider networks who contract with medical insurance companies and medical aids, and I'm sure there are agreements in place there. But I'm sure there's a lot of doctors out there also who don't have any agreement with the medical aids and then they're at the mercy of the healthcare insurance companies, or the medical aids as we call them. And so if the patient, if the third party doesn't pay the doctor, then the doctor has to seek payment from his patient, and oftentimes that causes a lot of problems. So the ex-chairman of the Medical Association here in South Africa, he said the third-party payment system is the fundamental problem in the doctor-patient relationship, which is true. It also disempowers doctors because, as I said, there's no legally binding guarantee of payment, and the doctor has no control over his income or her income. Okay, so it's a real issue. It may have gotten better over the years, but when I was in practice, this was a massive issue. Okay, then you have to switch to a membership-based model. Now, in 2005, way back then, I submitted a proposal to the Medical Association here in South Africa. It said it was entitled An Advanced Direct Payment System for General Medical Practitioners. It was, in essence, a membership-based model, and called a capitation. And I proposed that, we replace the third-party payer system with a direct payment system, that we replace the fee-for-service system with an advanced payment system, and that we reduce proportionally, the contribution that people pay to their medical aids. I don't want to explain all of these things now because it'll take a bit of time, but maybe during question and answer session we could do that. And there's a lot of benefits that, would accrue from this kind of model. It'll stimulate rigorous competition amongst practitioners, resulting in improved quality of care and service for patients. It'll curb medical inflation, at least at the level of the primary healthcare level, actually. Although most costs are driven by private hospitals and not your primary care practitioners. It also increases access to an affordability of private primary health care and improve doctor-patient relationships, sustain positive cash flow for GPs, elimination of the problems and costs associated with medical account submissions and payments. I'm going a bit fast because there's a lot of content to cover, and time moves quickly. So then immediate placement of financial and administrative control in the hands of the healthcare service provider, and restoration of destroyed goodwill. Because doctors build up their practice over years, and they build up goodwill in the practice, sometimes for retirement purposes. They want a nest egg. But this third-party payer service model tends to destroy that goodwill because of the reasons that I mentioned. And then also if you decorporatize healthcare, the private primary healthcare sector, that will also be one of the consequences of the model that I'm explaining. Because corporatization of healthcare is a big issue in also driving this global health crisis. By financial empowerment, what I mean is not only empowering the patient, but also empowering the doctor and the patient. There's big cost savings, with the membership-based model. If you pay a monthly membership to your doctor, and then you have unlimited access, you don't have to pay every time you see the doctor. But with the empowerment programs also, then you're becoming empowered, and your health and wellness improves, and that reduces the risk of future hospital events, and there's cost savings in the future also. So this model, there's big cost savings, related to this model. I'm also talking, when I talk about, financial empowerment, I'm talking about reducing the risk of being financially wiped out in the coming global economic crash. We're in the crisis, the crash, nobody knows when the major part of the crash is going to happen, but the specialists tell us that we're already in the process of crashing, and all fiat currencies are going to come crashing down with everything else, in this massive global economic crash that's going to happen. And so we need to prepare for that. And this model that I'm presenting today, is my thinking and my contribution, perhaps, to help solve it at least on one level. So we're going to exit the current fiat currency system and switch to a gold-backed virtual currency on the trading platform. This is called the ZA DINAR exchange. Now, it's a community exchange system. As I said, when I was at the business school and studied economics and finance, and I realized, it's not really the whole truth, I got involved in alternative economics in the early 2000s. And one of our projects was to set up this community exchange system here in Cape Town, South Africa. And now there's many community exchange systems around the world, and people exchange, with the virtual currency on a trading platform. So it serves two functions. It's an online exchange system that facilitates exchange in a number of different ways. And it's also an online marketplace where users advertise their skills, their offerings, and their requirements. Okay, so there's a little video on the Institute's website. It's about 2 minutes long, and it explains the financial component, of the Institute's offerings. I'm not going to play this video now, but if people are interested, they can just go to the website and it's just about, I think it's 2 minutes, very short. It explains how the platform works and the financial component and the goal-back part of it also. Okay, but as I said earlier on, people, if they don't like, virtual currency on a trading platform, there's always Bitcoin. Bitcoin is really taking off in a big way. People may or may not be aware of what Bitcoin is, and I really don't think, I should explain it right now. But it's also a virtual currency. What I'm concerned about it is not backed by any precious metals. It's quite risky. And the thing that bothers me most about Bitcoin now is that the banks and governments are starting to get involved with Bitcoin. In fact, an article that was published yesterday here in South Africa said the South African Reserve Bank loves the blockchain and what the Reserve Bank governor is doing to actually promote it. And I think when banks start getting involved in cryptocurrencies, I think it's time to perhaps head in the opposite direction. But that's just my opinion. Okay, and there's a war on cash happening at the moment also. It started in India, Venezuela now is outlawing cash. I think Spain and Greece maybe and some European countries are starting to ban cash. Now, David Icke said this a while ago. He said the war on cash is a war on freedom. I've been warning about the cashless society for decades. It's a massive trap. When all cash is gone, how do you buy anything when the computer says no to your digital money? Exactly, that's the idea. So it's very serious when you cannot even control and keep in your possession your own money, and it has to be held by the banking system. That, I think, if people really don't wake up to the seriousness of this situation, then I'm not sure if anything will really wake them up. So, this is the next step, and it's a massive step in the march towards total control, of the people around the world. So, yeah. So I'm just going to summarize quickly then. I'm done now. I spoke about two problems. One is the global health and economic crises, and then the crisis must be seen within the context of the globalist agenda. And part of the solution, as I said, is to merge medicine with health, wellness, and financial empowerment. I know there's some questions going to be posed, and I'm not going to mention them, but these are the questions that will come up. And I'd like to thank you for your attention. I really do appreciate it. Thank you very much. Alberto, I'm done. Thank you.
Thank you very much, Dr. Kirsten, for explaining to our audience and to our global audience your point of view. And now we continue this webinar with the next activity that, as Dr. Kirsten mentioned, will be the polls. So the question will appear as a pop-up on your screen, and you will have a few seconds to express your opinion between the options that we will give to you, and after we will comment the results. So here we have the first poll. Here are the results from our first poll today. What is the key driver of the global health and economic crisis? No answers for the option A, the globalist agenda. 67% of our attendees think that the humanity, the option B, and 33% of our attendees think that both. I don't know if Dr. Kirsten, you have something to comment about the answers from our audience.
Alberto, did you say 67% globalist agenda? Is that right?
No, I will repeat. 0% globalist agenda, there were no answers. 67% humanity and 33% both.
Oh, so 0% said globalist agenda, 67% said humanity, and 33% said both.
Yes, exactly.
Yeah. Look, I would say I would agree with the 33%. I think it's both are we both equally guilty of driving this global health crisis, global economic crisis. But I think a larger part would be I would put the I don't like to blame anybody, but the globalist agenda, I think I would give them a greater portion of the blame than humanity for various reasons. So I would go with both, but more blame on the globalist agenda. Drive more the globalist agenda driving the crises rather than humanity. Humanity has obviously a big role to play in it, and they're guilty on many levels also. But I think more blame should be on the globalist agenda.
Thank you very much, Dr. Kirsten, for your comment. And we continue with the next poll today. Here we have the results from our second poll today. What is the ultimate origin of this driver? And 100% of our attendees think that both the subconscious mind of the globalist, for example, their belief system, and the subconscious mind of the humanity. Professor Kirsten, you have some comment for this answer?
Oh, absolutely. I'm 100% with the audience also. It's both our subconscious minds, that of the globalists and that of of humanity, the rest of humanity. The globalists have a certain belief system which drives their behavior. They're a small part of humanity. I don't know if you want to include them in humanity, part of humanity, but humanity also, the subconscious minds of humanity. We're not really aware of what's in our subconscious minds, and our subconscious minds are programmed all the time to serve the agenda. So in essence, we are basically serving this agenda and enabling and perpetuating our own enslavement because we're just not aware that is the case. So yes, 100% behind with everybody. It's both. There's another level to this, but I'll not talk about that today. But ultimately, it's the subconscious minds of both. But because the globalists hold more power, and they've held more power for such a long time, most of humanity is now powerless. But it is their subconscious mind also which is driving this agenda, yeah. Driving this crisis, sorry, these crises, yeah.
Okay, perfect. Thank you very much. And we continue with our next poll today, last one for today. Here are the results from our last poll today. Very trendy, I should say. We should say, is President Trump really an anti-establishment or an agent or deception? 67% of our attendees think that is an agent of deception, and 33% of our attendees think that neither one nor the other. So it's not an anti-establishment or an agent of deception. So what do you think, Professor Kirsten, about that?
I would go with the 33. Well, I wouldn't say neither. I would say it's a very difficult question to answer. I've been following Trump, the elections and so forth, and I've always maintained that he has been selected to be president, and I was right when he was selected. or elected, as they say. I've looked at, his history, and in a sense, it's difficult to answer this question. He seems to be anti-establishment. He seems to be anti-globalist, but there's many, many signs pointing to the fact that he's actually establishment and is there to serve and drive the globalist agenda to its next phase. So the people who said neither one or the other, it's difficult for me to say which one also. But if I had to put my head on the block, I would say he's been put in place there to drive the globalist agenda to, in its next phase of development towards its ultimate goal, which is really scary. Okay, that's my 2 cents. Thanks.
Thank you very much. So for continue this webinar, I would like to invite our audience, if you have some question for Dr. Kirsten, that you can use one function that you have in your control panel that is called raise the hand, and we will open your microphone and you will be able to speak directly with Dr. Kirsten. So when the audience will think the questions, if they have some for us to you, Dr. Kirsten, I would like you to remark in 3 or 4 points what do you think that it was the most important part from your presentation, something that you can remark to our audience.
Okay, I'll do that, Alberto. Do you want me to do that now, Alberto?
Yes, please. Yes.
Oh, well, the most important points that I think that take-home message is that, first of all, people must be aware of what's going on in the world, in their own lives, and also in the world around them. So it's very, very, very important for people to increase their level of awareness. Now, that obviously is doable, but it takes action. It just won't happen like that. So people have to take certain steps and use certain tools to enhance and raise their level of awareness. That's critical. And then the next step is they need to really do research in terms of what is going on in their own lives, especially if they suffer from a chronic disease or any disease really, even if they're getting sick on a regular basis with acute illnesses. They really need to take the bull by the horns, do some research, and see why is the situation the way it is, and then take action, do something to basically turn the situation around so that we don't end up, with the globalists having won this battle and, we basically have nowhere to turn at the end of the day and complete slaves. Hopefully it won't end up that way, but we don't know. Yeah. Another point I think I want to make is that look at the allopathic model. And most people, go to a doctor who's an allopathic doctor. I'm an allopathically trained doctor myself, so I've been trained in Western medicine, and I realize in many ways I've been deceived. I realize the education system is very, very deceptive also. When I was at the business school, as I said, because I studied business also, and especially finance economics, a lot of things didn't make any sense to me, and I highlighted some of the points there in the presentation. So people must be very aware if they're studying at any institution, always question what you are being taught, because I'm not saying all of it is not true. Maybe 95% of it is true, but look for that 5% maybe that is not true, that you don't really think about because everything else sounds right. Look for that doesn't sound right to you, doesn't feel right, investigate it further, do more research in that area to try and come up with the real facts, because that's really crucial also. Yeah, that's it, Alberto.
Thank you very much, Professor Kirsten, for a small refresh about your interesting presentation and your point of view about one of the main problems that we have actually in the world. Looks like that our attendees don't have some questions, so from the International Health and Wealth Forum, we appreciate so much your disposition for being today with us, Professor Kirsten. Thank you once again. We hope to have you more times with us.
Thank you very much, Alberto, for giving me the opportunity once again, you and Martin and the forum. I really, really do appreciate it. And maybe the audience wants to email questions to you, and you can email them to me. If they have any questions, I'll be happy to look into those questions and answer them if I can.
Of course. If some people from the audience will have some questions or will send to us, we'll give your details to the person, and you can communicate directly. And before to finish this webinar, I would like to remind our attendees that our next webinar is scheduled for the 27th of February with our next speaker, Vic Cherikov from Australia, with the topic Wild Foods Looking Back 60,000 Years for Clues to Our Future Survival. And also, I would like to remind that this webinar is being recorded and will be available in some time through our website for the members that are registered. And if you are not member of the ISW forum, we would like you to be with us and to register. So thank you very much, and wishing everyone a fantastic day.
Thank you, Alberto. Bye.